Hey, Dr. Burrows, could you tell us what you think about the different lasers?
I'd be happy to. I began using lasers for skin treatments almost 30 years ago, where we only had the fully ablative CO2 lasers, but we've come a long way since then.
What's the difference between the erbium and the CO2 lasers?
They use different wavelengths, but they both target water in the outer layer of the skin. So they're both fantastic for tightening skin, working on wrinkles, pigmentary issues, as long as they're not melasma, and can help, even work on some deeper folds and help lift the skin. Now, generally, the CO2 can be more powerful, but that's not always uniformly across the case. Some of the erbiums can be quite powerful as well. One advantage with the erbium treatments is that darker pigment types can be treated reasonably safely, and you heal a lot quicker from the erbium, but the results aren't as long lasting.
But which gives the most transformation?
Well, it depends. So if you're a Hispanic female, kind of darker, you wouldn't want to go with CO2 laser too aggressively, or you could have pigmentary changes. But the erbium can still give nice results, but you may have to do more treatments. Whereas somebody more fair skinned, they can tolerate CO2 laser usually quite well, and you can get good results with 1 to 3 treatments that can last several years.
Is IPL a laser?
No, IPL stands for intense pulse light. Sometimes people reference it as a laser, but it's kind of unique that it works on pigment, redness of the skin, even fine blood vessels like some rosacea type patients have. And some of them can even have wavelengths that help with acne breakouts. So they have a very quick turnaround, and you don't have to have any downtime with them. Though sometimes, if you have a lot of pigment that needs to work to the surface, uh, you might want to cover that up until it finishes doing that.
What is the biggest misconception about lasers?
I would say that the same type of laser is going to give the same results no matter who's performing it or where it's being done. Uh, Here at Springs Aesthetics, we have spa level lasers that do some good, and they can be done with very quick turnaround and just with topical anesthetic. A lot of them you can just drive in, get it done, and go home yourself. Whereas with the physician directed, we go with more aggressive strengths and power settings so that we can get more transformation.
And do laser treatments hurt?
They could hurt, but we don't like pain here at Springs Aesthetics, so we try to make people comfortable. So we have very strong topical anesthetic, and we also have, with the physician strength ones that I direct, supervise, and or perform, I do nerve blocks, local anesthetic into the areas that we're treating, and we can sedate you even if need be.